Hi, this is Ed Harrow with the horribly named Ed Talks, and I have in with me Sean McAuliffe, who's our Board of Health guru, and Simone Carter, who's our Board of Health nurse. And we're going to talk about Board of Health things happening and things doing. But I started out like trying to educate myself a little bit. So I went to the town website and I went to the boards and committees page, and I clicked on the boards and committees page, and what to my surprise came up was not the Board of Health, not the members of the Board of Health, or the employee, the members of the Board of Health, but the employees of the Board of Health. So I found that a little confusing. So I want to touch on them by name and what I think they do, and then I want you to say, no, Ed, this is what they do. So we have Sean McAuliffe, who's the big boss, tells everybody what to do. He's the front guy. He's the one that takes the hits. We have Nadia,
right,
who is the admin person, who is a sheer delight and always has nice things to say to me in town hall, which is scary.
She's the order in the department. The order.
Yes.
And then we have Brian Besso, and my story on Brian Besso is we had to get a new septic system. And we'd maintained our old decrepit one through the loving care of a very large silver maple tree that was sucking the life out of the septic system, but eventually things went to a head when my mother was living with us and the poor tree had to go. But when Brian came out and looked in the hole where the septic system was probably going to go, he looked at me and he goes, Ed, you know what people in Hopkinton would pay you for your dirt? So that's my Brian story. And then we have Simone, who's here with us, who has been with us for how many years now?
Since 21.
Since 21. So you came after Casey.
Yes.
And Simone has many stories to tell. And lastly, we have Kelechi, who is a fabulous guy who lives in Lowell, who he and I have had chats about the Lowell event they have up there with human-powered vehicles that have to go over streets and through swamps and through the river and so forth. It's a great fun, and I highly recommend it. So, now, what have I missed with what you guys do?
Well, I think, with Kelechi's in charge of environmental inspection, so housing, camps, pools, restaurants. He addresses most complaints. The complaints that are specifically of an environmental nature, those come up to me. But he is basically, he's my eyes and ears throughout the community, and he's the one who keeps all of our retail establishments in order and most importantly safe. Brian's regarded as one of the top well and septic guys in the region. He devotes most of his time to Hopkinton, and we wouldn't be able to do what we do in town as far as programming, without Brian's expertise, because I'd be spending 20 plus hours a week doing nothing but septic.
Nadia keeps us all together. We could not,
Right.
I don't think we could function without her.
Right.
And I head up the nursing efforts, and that can range anywhere from connecting someone with their doctor if they need it, or helping them figure out medications, connecting them with the right resources in town, whether that be youth and family services or perhaps financial assistance in some way, the senior center, transportation to appointments. We also offer vaccinations for adults and children. And we do a lot of health promotion and cross departmental work with the fire department, youth and family services, the senior center, the library, all of our kind of human services. And I work as well with the school nurses when they have a question about something that's going on with a health record or a status of a child at times. So yeah, I kind of touch people hopefully wherever they are and when they need.
Okay. We don't have anyone from the actual Board of Health.
Those
which is-
guys are elected.
Right, I'm going to say, they are elected, and there's 3 members of the board, Richard Jacobs, Nasibi Manon, and Mary Jo Ondrican. I'm never quite sure how to say her last name. And are there any particular requirements to run for the elected position on the Board of Health?
There aren't. They're working toward, the state is actually working to set standards for the board members. And we have groups like the Mass Health Officers Association and the Mass Association of Health Boards that work to help educate board members. But, you know, in Hopkinton's case, the board members are here to establish overarching policy and to provide me general guidance on, because, you know, I'm not a resident, so as residents, I rely on them to, you know, for input on what the residents in Hopkinton
Right.
would like to be done.
And Mary Jo is PhD.
She's amazing. I mean,
And
they-
Richard Jacobs is
he's
an
a-
MD?
Yep. And Nasib is in health policy. So they're all well qualified, and we work really well together. And you know, we've helped. They helped us get the strategic plan through, and you know, we're moving forward on the plan. They're great advocates for different groups within the community,
And they add a layer of accountability
Right.
because Sean, I mean, the way that it's set up is each home rule in Massachusetts means that the people in town have a say in, I mean, there are general guidelines from the state, but what the board does is provides not only oversight, but as well they can advocate for us or for our programming in a way that is separate from perhaps the town's power structure. So that kind of adds a layer of, again, I'm going to say advocacy for the community residents.
Yep.
and they're my boss. Like, I work for the board. I don't
Gotcha.
I work for the board and not the town.
So similar to
Parks and Rec.
Parks and Rec, similar to Concom having a conservation agent.
Right, exactly.
So, and then in terms of current health issues, I know we have measles running around. And I've had my first tick. My dear wife has had her first tick. I mean, you know, ones that were, at least neither of us at this time had to go to the doc and get the remnants cut out. We were able to get them out in its entirety, but last year I had 2 that I had to go and have scalpeled out.
And, I mean, prior to COVID, tick-borne disease was the leading source of illness in the community, and our counts, we know that our counts were generally 4 times lower than they actually are. So I think we were averaging between 60 and 80 cases a year. We're still seeing elevated numbers. The good thing that's just being reported is that the new Lyme disease vaccine should be coming out either in late 26 or early 27, and that vaccination was developed by a local researcher based out of Tufts Grafton, Sam Telford, and this time he worked with, I believe, Pfizer to develop this vaccine. I had the original vaccine back in 92 to 93. It was a 3-series shot. But that's some of the work that we do locally. There are a group of health directors that we obtain blood samples and tick samples, we ship them off to 2 research laboratories.
To
and
see
yeah.
exactly what diseases our ticks are carrying.
Yeah, what they're carrying, and they breed the ticks that we harvest, and they use those ticks to help develop vaccines. So it's going to be a pretty significant change, I think, in the health of the community once this vaccine becomes available.
You made a comment which I'm not quite sure that I caught. It sounded like what you said was the cases that we see are a fraction of the actual cases?
Many doctors don't know that they're responsible for reporting
Aha,
tick-borne disease.
okay, gotcha.
And in general, the numbers that Simone and I see on the state in the state database are generally, depending on the disease, say 2 to 4 or 2 to 5 times lower than what's actually spreading around in the community.
And in defense, so there are certain diseases that if it goes through a lab, it automatically flows into the state's network that monitors these things. But there are times when you may go to your physician and explain what's going on. They may empirically treat you without testing. So there are cases that aren't reported because they just simply weren't tested. Think like if you had a stomach bug, you wouldn't necessarily go and get tested for which exact bug.
Right.
Or the flu.
Yeah. The tick thing is interesting because I grew up in Westwood. I grew up adjacent to a pond. I grew up with a backyard full of woods. Never saw a tick until I was probably 9 years old. Tarpaulin Cove, which is on the Elizabeth Island south of the Cape. And when we took the dog ashore to make her morning or evening run before a day of being on the boat, that was the first time I saw a tick.
Yeah.
I never saw a tick again. I'm not making this up until my family moved to Norwell. And when the different dog, but when the dog came in, because dogs ran around, dogs were loose. I got to hold up the right number of fingers. Dog came in with 9 ticks, 1969. So that's a difference of, that's a 10-year difference between when I first saw a tick and then this episode in Norwell. And now, I mean, my record, so our current dog is mostly Great Pyrenees. He's 100 pounds, he's white and fluffy. I'm not exaggerating. I was on a open space walk, and Moosalaki formerly, was running. I was being very bad. He was running loose. He was not on a leash. Came home. This many ticks. I am not exaggerating. 10, 20, 30, something close to 40 ticks.
Yes, easily.
Being white, being thick coat, they were all right on the surface and could just pluck them off. And yes, and he takes the pill and so forth and so on.
I've been in.
So what is causing the increase?
Well, it's partly climate change. It's new species moving up, so that's all contributing to it. It's as more mice and other rodents that move the ticks around, as more of those survive the winter, they're spreading the ticks, and then birds can help bring in. I believe there's a study recently that one of the reasons why we see the Lone Star ticks on the Cape and Islands and not, in the interior of the state right now, it's because that's one of the migratory pathways, and that's where those the birds are flying up that pathway, and that's where they're depositing those ticks. But that's, and one of the things that we do is, we go out. I do surveillance every year. I look at the YMCA, the schools, and I'll go out into certain areas that the public frequents look and I'll flag for ticks to see how many are, in that specific area. And then we can get out educational material. And then it's spraying, but I prefer that people just protect themselves. When I'm working out in the yard, I have a set, I have a set of pants, and socks, and work boots that I wear, so I spray those with permethrin. We're being pushed to really focus on foundational medicine moving forward. So one of the things that I've been talking about is, it's important if people need glasses, they should wear the glasses when they're outside and working in the garden. Because if you can't read the text on a page without your glasses, you're certainly not going to be able to see the tick that's walking up your leg. And I mean, I've got your 35 or so beat, because I was working in a residence yard with one of my interns, and between the two of us, we plucked over 100 off of us. We went through a turkey roost, and we were covered, and we were sitting in a driveway. We both had white pants on, and we were just plucking them off, putting them in ethanol bottles, and then I delivered that up to Tufts Grafton for
I
research.
have a good tick story. I got out of a speeding ticket in Hopkinton after doing a Conservation Commission walk and wearing light-colored pants and coming out and So I'm hot-footing at home because all I want to do is get my clothes off.
Right.
And I told the officer, I said, "You better let me go or I'm going to take my clothes off right here." I don't recommend that, but it worked.
Yeah, no.
And then measles is the other thing do we have any measles cases in town?
We do not. No.
So Massachusetts, because we do more,
So Massachusetts has a really good vaccine coverage as far as we have herd immunity is what it's technically called. So we have like 94, 95, 96% vaccination rate, which is like number one, what we can do to prevent the disease. There are still pockets of communities, for whatever reason, that may be under-vaccinated. Hopkinton is not one of them. Again, I suspect that if we do see a case, at some point it will be due to travel-related exposure, and perhaps that person is under-vaccinated. But at this time, what can we do? We shouldn't panic. We should just make sure that we're up to date on our MMR vaccine. And pretty much anyone who was born before 1959 or after 1967, if you received the 2 doses of the MMR vaccine, you are covered. There is a small subset of folks who were born in that little time period where the vaccine was not as effective.
Right.
So those folks should chat with their doctor and get vaccinated so that they are sure that they have coverage. I don't really recommend doing titers because insurance doesn't always cover that.
Right.
And if there's ever a question, you can get an additional vaccine. It won't harm you.
what does NMR stand for?
Measles, mumps, and rubella. And you call me out anytime I do that. We in public health tend to run on with
Oh, you are not
acronyms.
alone. You are
And
not alone.
I am sorry. Yeah.
But if you're we're going to a conference representing the Middlesex
Cambridge,
County.
yeah.
And we're going it's in Texas. So I, being one of those that was born.
We're dating him.
Yeah. I got my first shot during that period where there's a question about how effective the vaccine was. So I went and got boosted before I went. And I recommend anybody who's traveling to a hot spot that is either immunocompromised or is born in that basically 9-year window, they should get.
And what's that window again?
1959 to, let's be on the safe side, 1968.
Yeah,
I want to say
yeah.
67. I'm not,
Like,
I can
it's-
double check, but
Yeah, 68 would be a because
yeah.
I got my first shot at the beginning of 67, and the pharmacist asked, first question, do you know when you got your first shot? And I said, 67. He's like, without missing a beat, he's like, check, you're eligible. and then, because I was eligible, there was no question about me getting covered for the shot. But, and then Nasiba said if I didn't get the shot, she wouldn't allow me to go to any meetings anymore because she didn't want to be around me for like 2 to 3 weeks. But it's yeah.
very, very contagious. That's why it spreads so quickly. If the droplets remain in the air for like 2 hours, and it's so much more contagious than COVID or the flu.
Really?
So if there is a measles case that's diagnosed in a hospital or a doctor's office, you cannot imagine the amount of contact tracing that
Right.
goes into that.
Oh, yeah.
Yeah.
So, but so far, knock wood, we
Here,
have,
right here.
yeah, we've been okay. But the cases are rising
Right.
in the nation for sure,
Yeah.
and it's within these again places that, and there's no judgment here. For whatever reason, there are pockets, and they just haven't been vaccinated. So that's.
And I just had a representative from the state health department call me back because I wouldn't say that I'm an agitator, but I like asking questions. Yeah, we share a lot of the same.
Do you drink your coffee black?
I am now, but I share.
I have to share an article with you.
So they said, you have often said that Hopkinton has one of the greatest arrays of illnesses, and none of us believed you. And then we went and verified and validated that Hopkinton has one of the craziest sets of illnesses, and a lot of that is attributed, as
To
Simone had
travel.
said, to travel.
But not to altitude.
No. But it's, I mean,
For those that don't know, Hopkinton is the highest town in Middlesex County.
but we've seen a fair amount of disease, and it's one of the things that the state, because of our backgrounds, the state actually trusts us to take care of things without really much oversight. But a lot of that's attributed to, Simone's
Oh, we work together.
qualifications.
We
Yeah,
work together.
Any other things that you,
So I would say, right now we're going through a change in our funding sources. And that does directly affect folks. I don't know that we are going to feel it right this minute in Hopkinton, but we will feel it. So it's really important to keep ourselves operational, which we are. But we can advocate for the budget to be passed that the governor has approved with our representatives, and we have done that.
Right.
The budget that is just the overall budget for public health, as well as amendment, I want to say it's 1128, which ensures for this next budget period and ongoing, and I know it will be revisited every year, but adult and children vaccination programs, even if those funds, which they are being pulled or
Right.
trying, that's on the federal level, that's a process that I believe they're fighting in the courts, but if we can get that passed, that will give folks who are underinsured or have no insurance access to those basic adult vaccines that they need.
Yeah.
So that's what we can do going.
And we're, generally speaking, what we're focusing on right now is how to take care of the residents in our community as best as we can. Working, we're seeing that the cuts they're going to have dramatic effects on the state health department. I just received a letter last night that it looks like they're going to be able to pay my summer intern. But we're, on any given day, I get emails that, everybody that's going to be on the conference call with you today aren't likely to have a job tomorrow. So we're seeing on the state level that a significant number of people are likely to lose their jobs. So what we're just focused on, what can we do to strengthen the department and
keep and the more we keep our community healthy, then that puts less strains on our EMS, our hospitals,
Right.
Primary care physicians. Those, we have a shortage of those. So, there's a ripple effect, and we're just like one day at a time. One foot
Okay.
in front of the other.
So our time is rapidly coming to an end. I thank you for your time and your efforts and your work and your companionship and your friendship and that of your staff. And I especially thank for the entertainment of the hole in our backyard as being the best dirt in Hopkinton.
Yeah.
It really made my day, and thanks to Brian for that.
Thank you.
Thank you both. Have a great day.
You too.